Hi everyone. So today I wanted to talk to you about an advancement proposal for a new healthcare model for psychology patients, primarily focusing on female oncology patients. I'm going to go over the prevalence of distress disorders in oncology patients, my proposed new model, the benefits to patients and providers, and some things to consider about the new model. About 30% of all oncology patients develop some form of depression or anxiety, but only 6% seek professional help. When I started this project, I knew that statistic would be kind of low, but I was really surprised that it was only 6%, and it made me wonder why. Is it because of resources, insurance coverage? What factors are leading only 6% of oncology patients to seek psychology help after a cancer diagnosis? The prevalence of depression and anxiety is primarily high in newly diagnosed female oncology patients, with 41% of women with breast cancer and 30% of women with gynecological cancers developing some form of distress after a cancer diagnosis. But it's important to understand that these women are going to continue to battle that depression, anxiety, or PTSD long into survivorship. It's not going to just go away after they're cured. So obviously there's a great need for psycho-oncology services and the need for screening and treatment of distress at all stages of the oncology journey. So diagnosis, treatment, palliative care, so women who are not curable and at that stage at the end of their life are going to have a lot of questions, a lot of concerns, and they're going to have a lot of emotions and could really use a support system. And women in their survivorship stage, so those who are curable or already in remission, are going to have a lot of anxiety and be really concerned about their cancer coming back and could use somebody to talk to. There are multiple reasons behind ineffective treatment, lack of trained professionals. There's a need for psychology providers and psychiatric providers, but there are less people going into that profession. Issues with insurance coverage and cost, stigma and privacy concerns, so people who are concerned that if they go to a psychologist then maybe they're crazy or they're going to be judged, and a geographical distance from providers. So providers for psychology and psychiatric services are primarily based in urban areas, and that puts rural patients at a deficit. So there's a need for psychotherapy interventions to address these concerns, and one of the interventions that I'm proposing is using the internet. One of my sources says that internet interventions have the potential to fill an important gap in quality cancer care by adding to limited available mental health services. So using the internet would allow women who do not have time, cannot afford, or do not have access to traditional psychotherapy services would really help them benefit and would allow them to see a provider to help address some of their concerns and their needs. Right now, there are internet services that allow for research of medical conditions and discussion, like WebMD, but none that allow for the actual diagnosis, management, or treatment of psychological disorders. So a well-developed internet application could help track distress symptoms, consult with healthcare professionals, diagnose conditions, treat and manage those conditions, and then set up some kind of virtual support group where women can chat with their peers about similar experiences. Women are already balancing a lot of oncology-related appointments after a cancer diagnosis, in addition to being the primary caregivers in their household. Psychology appointments are often a last concern or thrown by the wayside, and that's not good because those women are already overwhelmed and could really benefit from having somebody to talk to. There's also a need for support beyond the typical 9-to-5 doctor schedule, since there could be a catalyst at work, school, or at their kid's soccer game that could cause a woman to have a breakdown where she needs to talk to somebody. Internet psychotherapy services could be available 24/7, 365 to address a woman's concerns at her convenience. Like I mentioned, psychology and psychiatric services are located primarily in urban areas, which puts people in rural areas at a disadvantage. In addition to geographical distance, women who are disabled might have a hard time getting into a physical psychology office, so it would be helpful if they had the internet, because then they can seek those services without having to leave their home. It also provides confidentiality because women can privately seek mental health treatment without facing stigma or embarrassment of running into somebody in a waiting room that they know. Cultural and language barriers are also a major issue with psychology services. Cancer does not discriminate based on language, ethnic beliefs, or cultural values, so foreign women may have difficulty finding a provider who speaks their native language or shares similar beliefs. Additionally, foreign women might have a hard time finding a provider who understands their preferences and treatment methods. For example, there are some Asian cultures where women, after being diagnosed with a condition like cancer, will forego any treatment and may elect for holistic medicine, and that might be ridiculed by some Western doctors. So an internet-based psychotherapy service would allow women to search for and speak with providers all across the country or even internationally with psychologists or psychiatrists who share the same beliefs and speak the same language. There are also issues with insurance coverage. Like many other medical conditions, people with cancer are at a disadvantage when it comes to insurances, and a lot of their services aren't covered at 100%. And a lot of women of lower socioeconomic status rely on insurance providers like Medicaid and Medicare. But currently only 43% of U.S. psychiatric providers participate with Medicaid programs, and those participating providers often have long wait lists just to schedule a single appointment. And it's important that women, when they have a catalyst or they have a breakdown, that they have somebody to talk to at that moment or relatively soon, because it's not going to help if they have to wait several months to discuss an experience that they're experiencing in the present. So an internet-based psychotherapy service could offer low-cost services to women who wish to pay out of pocket and could also participate with state and federal insurances. And how will this benefit physicians? Well, it would help satisfy requirements set forth by accreditation organizations that require oncology hospitals and oncology cancer institutes to implement survivorship programs, which include psychology services. It would also lower overhead costs for physical practices for psychologists and psychiatrists, and would allow physicians to work on their own schedule. Referring providers would also be able to see that their patient needs are being addressed in a timely manner, and it would allow them to have access to track their patient's progress and their outcomes in the internet-based application. So how can we fund a program like this? Well, it could be provided by stakeholders like accreditation organizations, federally funded by the government, special interest organizations like the American Cancer Society, and even some insurance companies are already paying for online physician visits for medical issues like Aetna, Cigna, and Humana. Similar services already exist for medical visits like American Well, MD Live, and MeMD. Patients can go online and talk to a doctor for about 15 visits for anywhere between $20 and $50 and get a diagnosis for a medical condition that they might be having, and then possibly get a prescription or a treatment method to help them recover. And in 2009, 39% of doctors were already communicating with their patients online in some form, so maybe through some form of social media or instant messaging. So why not get online and communicate with your patients and get paid for it? So how can we develop and implement a program like this? Well, the FDA is already aware of mobile medical applications, and they are setting up regulations and policies and are monitoring and tracking these programs. So it's easy for a application developer to go online, look at the regulations and policies, and see how they can develop an application. An estimated 500 million smartphone users are already using some form of a mobile medical application. So a psychiatric service may really benefit patients who need to have psychology services on their schedule at their time, at their convenience. So in conclusion, the lack of accessibility and availability of psychotherapy resources calls for the need for a new intervention. An internet-based psychology service would benefit the staggering number of female cancer patients who need help with managing their distress by accommodating their schedules, geographical distances, privacy concerns, language and cultural barriers, and insurance limitations. It would also benefit both the providing and referring physicians. It's evident that people are already relying on the internet for medical help, so psychological help should be available too. It would help oncology patients combat distress conditions and improve their quality of life throughout their entire oncology journey. Thanks so much, guys.